Look at your hands right now. Right now, before you do anything else. 10 small plates at the tips of your fingers. Most people see cosmetics, maybe a chipped edge, a hangnail, something to fix before a date. I see diagnosis. 15 years of clinical practice, and I have watched heart failure, liver disease, and lung cancer announce themselves on fingernails long before the patient felt a single symptom. And here is what nobody will tell you. The system you rely on for your health is not built to keep you healthy. It is built to treat you when you get sick. There is no billing code for prevention. Your next appointment will not include a nail exam. But today, you are going to learn exactly what to look for. Subscribe to Dr. Waterling right now and hit that like button. We are working toward 1,000 subscribers, and we are building this channel on one principle. The healthcare industry does not profit from you solving this at home. The system makes money when you stay sick, not when you get better. So, I am going to show you what 15 years of clinical observation has taught me about reading the signals your body sends through your nails. Every single day, millions of people look at their hands dozens of times. Typing, eating, driving, gesturing. And they miss the warnings. Not because they are careless, but because nobody ever taught them what to see. A vertical ridge appears. A white spot shows up. The nail bed turns pale. And the person thinks nothing of it. Meanwhile, inside the body, a process is accelerating. Oxygen is not reaching tissues. The liver is accumulating damage. Circulation is failing. And the nails are screaming the truth in a language the person does not speak. Let me be direct with you. By the time many serious diseases produce symptoms you can feel, damage has already occurred. Pain, fatigue, shortness of breath, these arrive late in the disease process. But your nails change early. They change when intervention is still effective. They change when reversing the condition is still possible. The window between manageable strain and irreversible damage narrows with every month you ignore what your body is showing you. Now, let me explain exactly what is happening inside your body and why your nails reflect it with such precision. Your nails are made of keratin, the same structural protein that forms your hair and the outer layer of your skin. But unlike skin, which constantly sheds and renews, your nails grow in one direction only, from the matrix at the base of your nail outward toward the tip. This creates a permanent record. Think of it as a biological timeline. Everything that affects your body during the 3 to 6 months it takes a fingernail to grow from base to tip leaves a mark. Nutritional deficiencies, oxygen deprivation, toxin exposure, hormonal shifts, all of it gets encoded into the structure of the nail as it forms. The nail bed, the skin underneath the nail plate, is one of the most densely vascularized tissues in your body. That means it is packed with tiny blood vessels, capillaries so small that red blood cells pass through them in single file. This makes the nail bed exquisitely sensitive to changes in blood oxygen levels, circulation efficiency, and systemic inflammation. When something goes wrong deeper in the body, the nail bed responds immediately. The color changes, the texture shifts, the growth pattern alters. And because the nail itself is translucent, you can see these changes directly. Here is the mechanism. When your heart begins to fail and cannot pump blood efficiently, oxygen delivery to peripheral tissues drops. The nail beds, being at the furthest point from the heart, are among the first places where this oxygen deprivation becomes visible. The tissue turns pale, sometimes bluish. When your liver accumulates damage and can no longer process toxins effectively, waste products build up in the bloodstream. These toxins interfere with keratin production in the nail matrix. The result is visible deformities, white bands, irregular texture, brittleness. When your lungs are diseased and cannot oxygenate blood properly, the body compensates by increasing blood flow to the fingertips in an attempt to extract more oxygen. This causes the tissue at the base of the nail to swell and the nail itself to curve downward. This is called clubbing, and it is one of the most serious nail changes you can see. Now the 7 warning signs. I want you to examine your nails as I describe each one. This is not abstract medical theory. This is practical diagnostic observation you can perform right now. Warning sign number 1. Pale or white nail beds. Press down on your fingernail and release. The nail bed should turn white from the pressure, then immediately flush pink again when you release. That pink color is blood returning to the capillaries. If your nail beds are pale even without pressure, almost white or very light pink, that indicates anemia. Anemia means your blood does not contain enough red blood cells or enough hemoglobin to carry adequate oxygen. This is not cosmetic. Severe anemia strains your heart because the organ has to pump harder and faster to deliver the limited oxygen available. Left untreated, chronic anemia leads to heart enlargement, arrhythmias, and eventually heart failure. The most common cause in adults over 50 is iron deficiency, often from slow gastrointestinal bleeding that the person does not notice. A bleeding ulcer, a polyp in the colon, chronic use of aspirin or anti-inflammatory medications, all of these can cause gradual blood loss that shows up first in pale nail beds. Warning sign number 2, vertical ridges. This is kind of Run your finger across your nails from the cuticle toward the tip. Do you feel raised lines running lengthwise? Mild ridging is normal with age as nail growth slows and becomes less uniform. But deep, pronounced vertical ridges, especially if they appear suddenly or worsen rapidly, indicate nutritional deficiency or malabsorption. The most common culprits are B vitamin deficiencies, particularly B12 and folate, and protein deficiency. Your body prioritizes survival. When nutrients are scarce, it allocates them to vital organs first. Nails, hair, and skin get whatever is left over. If the ridges are accompanied by fatigue, memory problems, or numbness in the hands and feet, you likely have B12 deficiency, which can cause irreversible nerve damage if it continues for years. The digestive system in adults over 60 often produces less intrinsic factor, a protein needed to absorb B12 from food. This means you can eat a nutritionally adequate diet and still become deficient because your body cannot absorb what you consume. Warning sign number 3, clubbing. This is the most serious change on this list. Look at your finger from the side. The normal angle between the nail and the skin at the base of the nail is about 160 degrees. In clubbing, this angle disappears. The nail curves downward and the fingertip becomes bulbous, swollen. The medical term is Shamroth sign. Press the nails of your index fingers together, tip to tip. Normally, you see a small diamond-shaped gap between the nail beds. In clubbing, that gap disappears. The nails touch along their entire length. Clubbing indicates chronic low oxygen levels in the blood. The most common causes are lung disease, particularly chronic obstructive pulmonary disease, interstitial lung disease, and lung cancer, and heart disease, especially congenital heart defects and infections of the heart valves. This is not something to self-treat. If you see clubbing and you do not already have a diagnosis explaining it, you need a chest x-ray, lung function tests, and an echocardiogram within the next 2 weeks. Clubbing does not appear overnight. It develops over months or years as the underlying disease progresses. But once it is present, it means the disease is advanced enough to cause measurable oxygen deprivation. Warning sign number 4, horizontal lines or grooves. These are called Bowes lines. They run across the nail from side to side, perpendicular to growth direction. They represent a temporary halt or severe disruption in nail growth. When the body experiences major stress, severe illness, high fever, surgery, chemotherapy, extreme malnutrition, it stops producing nails temporarily. Resources get diverted entirely to survival. When nail growth resumes, the interruption leaves a permanent groove in the nail plate. No says, "Nauke dasats, naster kroristat." You can estimate when the stress occurred by measuring the distance from the groove to the cuticle. Nails grow approximately 3 millimeters per month. A groove 5 millimeters from the cuticle indicates a severe stress event about 6 weeks ago. A single Bowes line is usually benign, a record of a past illness that has resolved. But multiple lines indicate repeated severe stress or chronic illness. And if you see a new line forming at the base of the nail right now, your body is currently under significant physiological strain, even if you feel relatively normal. Warning sign number 5, white spots or streaks. Most people have been told these indicate calcium deficiency. That is completely false. Research published in the British Journal of Dermatology, one of the most authoritative peer-reviewed journals in dermatology, has definitively disproven any link between those white spots and calcium deficiency. The actual cause is minor trauma to the nail matrix, the growth zone at the base of the nail. Bumping your finger, pressing too hard during a manicure, even repetitive keyboard use can cause small areas of disrupted keratin production that appear as white spots. These are medically insignificant in isolation. However, if you see true leukonychia, meaning the entire nail turns white and opaque, that is a different condition entirely. Total nail whiteness indicates either severe liver disease, particularly cirrhosis, or severe kidney disease. The mechanism is protein abnormalities in the blood that alter nail bed color. If your nails are turning completely white and you have not been diagnosed with liver or kidney disease, you need blood tests immediately. Liver enzymes, bilirubin, creatinine, and albumin will reveal the problem. Warning sign number 6. Yellow nails. No das. Mild yellowing with age is normal, as keratin oxidizes over decades of exposure to air and light. But thick yellow nails that grow very slowly and may separate from the nail bed indicate yellow nail syndrome. This is associated with chronic respiratory diseases, particularly bronchiectasis and chronic sinusitis, lymphatic system dysfunction, and autoimmune diseases, including rheumatoid arthritis. The yellow color comes from protein leakage from damaged capillaries in the nail bed. The slow growth reflects overall metabolic suppression. Yellow nail syndrome is rare, but when it appears, it almost always indicates serious underlying disease that requires treatment. In my clinical practice, I have seen 3 cases. All 3 patients had undiagnosed lung disease. The nail changes prompted the imaging that found the problem. Warning sign number 7. Dark streaks or bands. This is the warning sign that causes the most anxiety and the most confusion. A single dark vertical line running from cuticle to tip can be completely benign, particularly in people with darker skin tones where melanin production in the nail matrix is common. But a dark streak that appears suddenly, widens over time, or has irregular borders requires immediate evaluation. It could be subungual melanoma, a form of skin cancer that originates under the nail. Melanoma is one of the most aggressive cancers. Early detection is the difference between minor surgery with near certain cure and metastatic disease with poor prognosis. The warning signs within the warning sign are these. The streak is wider at the cuticle than at the tip, indicating the source is actively producing more pigment. The pigment extends onto the skin around the nail, called Hutchinson's sign. The streak appears on only one nail, particularly the thumb or big toe, the most common locations for subungual melanoma. If any of those apply to you, see a dermatologist this week, not next month. You need a biopsy. Now, what should you do with this information? First, examine your nails carefully in good natural light. Look at all 10 fingernails and all 10 toenails. The toenails can show the same changes, sometimes earlier because they grow more slowly and retain evidence longer. Second, take photographs. Your phone camera is sufficient. Photograph each hand with the fingers spread and the nails clearly visible. Store these photos with a date label. In 3 months, take new photographs. Comparison over time reveals changes that are too gradual to notice day to day. Third, if you see any of the serious warning signs, clubbing, complete whitening, widening dark streaks, do not wait. Schedule an appointment with your primary care physician within 1 week and specifically mention the nail changes. Bring your photographs. But here's what I want you to understand about the system. Most doctors will spend 8 seconds looking at your hands during a physical exam. They will check for tremor, look at the skin, and move on. Nail examination is not part of standard screening protocols, despite the fact that it costs nothing, takes seconds, and can reveal life-threatening diseases. Why? Because there is no billing code for it. There is no revenue mechanism. The system is not designed to look for early warnings. It is designed to treat crises after they occur. Your vigilance is the only prevention that exists. Let me tell you about Margaret. She was 63 when she came to my office for a routine medication refill. As I was writing the prescription, I glanced at her hands and stopped. Her nails were clubbed. The angle had completely disappeared. The fingertips were bulbous. I asked her if she had any breathing problems. She said no, she felt fine, just a little more winded walking upstairs than she used to be. But she assumed that was normal aging. I sent her for a chest x-ray that afternoon. The radiologist called me 2 hours later. Lung mass, 4 centimeters, right upper lobe. Biopsy confirmed non-small cell lung cancer. Because we caught it when she still felt fine. Before it spread beyond the lung, she was a surgical candidate. They removed the tumor. 5 years later, she remains cancer-free. Her nails saved her life. If she had waited until she developed a cough, chest pain, weight loss, the cancer would have been inoperable. Now the question everyone asks, can you reverse nail changes? The answer depends entirely on the underlying cause. If the cause is nutritional deficiency, correcting the deficiency reverses the changes within 3 to 6 months as new, healthy nail grows in to replace the deficient nail. If the cause is chronic disease, treating the disease may or may not reverse the nail changes, but it will prevent further deterioration. If the cause is genetic or structural, like clubbing from congenital heart disease, the changes are permanent. But even when changes cannot be reversed, identifying them early allows treatment of the underlying disease before irreversible organ damage occurs. Here is your action protocol. Every month, on the first day of the month, examine your nails under bright light. Use the same lighting and the same time of day for consistency. Check for color changes, texture changes, new ridges or lines, separation from the nail bed, and shape changes. If you see anything concerning, document it with a photograph and note the date. If the change persists for more than 4 weeks or worsens, schedule a medical appointment. Do not wait for pain. Do not wait for other symptoms. The entire point of reading nail signs is early detection before symptoms appear. If you are currently taking medications for heart disease, lung disease, liver disease, or kidney disease, do not stop them based on anything in this video. Nail examination works alongside medical treatment, not instead of it. The purpose is early detection and monitoring, not self-diagnosis and self-treatment. Discuss any changes you observe with your prescribing physician. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. And if this video helped you, send it to someone you care about, a parent, a friend, someone who might be ignoring a signal right now that they did not know meant anything. You may have just given them a real chance to catch something early. Subscribe to Dr. Waterling. We are building a community of people who refuse to accept that aging means inevitable decline. Your body sends signals constantly. Most people never learn the language. Now you know 7 of the most important words in that language. Use them.